Good evening, everyone. Thanks to those of you who are tuning in and watching. Tonight's webinar is on the wrist and hand, and this is a pretty hot topic for quite a few cyclists, actually. Now, we know that there's a small lag on the webinars that we live stream, so just bear in mind that if you've got any questions, pop them in the comments box really as we go along, and we'll get to them and we'll answer them. And additionally, if you think, oh, I'd want to know any more information about, cycling medicine and kind of bike fitting tips, you can head over to our YouTube channel, which is at Cycling Physios. But otherwise, without further ado, we'll start. So over to you, Tim.
Okay, thanks very much, Bianca. So yes, today we are going to go through the wrist and the hand, but first of all, the usual recap of who we are. So we got Bianca Broadbent, got tongue-tied there, and myself, Tim Pigott. We are both sports physiotherapists and bike fitters, and we've got sort of over 30 years experience between us. I'm also a university lecturer, and Bianca's helped out with lecturing with us in the past. We're doing research as well at sort of postgraduate level and specialising in biomechanics. And we work with both our sort of average weekend warriors, just general enthusiasts, all the way through to elite riders. So we've got a good wealth of experience from a very broad background in order to help support you and pass on the knowledge that we've gained along the way. Tonight's talk also fits into a bigger structure, excuse me, where we've got a lot of previously recorded lectures or workshops that we've talked through. So do have a look on our YouTube channel, and this also fits into a much broader spectrum of topics that we're going to cover. By the way, if I start sweating, it's going to put an extra log on the fire before doing this, and my back is now burning, so apologies about that one. So this fits into our talk about sort of more common injuries that you might come across in your clinic. So are you a physio who maybe comes across cyclists in your clinic, and you need to learn a little bit more about the specifics of what cyclists are doing and the specifics of interaction with the bike? Or are you maybe a bike fitter who needs to upskill a little bit more around the management or advice on any injuries that you are able to offer? So this is where this talk's fitting in. Tonight's learning objectives are to go through a little bit of relevant hand and wrist anatomy. We're only going to cover that very briefly, and then go through some of the common and maybe some of the less common hand and wrist problems that may occur in cyclists and therefore that you see in your clinics. And then understand how the bike ergonomics can be manipulated to try and improve comfort or reduce the symptoms that your patients or your athletes are presenting with. So why are we covering this one? Obviously, the hand is one of our key contact points, and the common injury that most people have heard of is the ulnar nerve or median nerve palsies, otherwise known as cyclist palsy, which specifically relates to the ulnar nerve. So it's this term which you'll often hear about in the hand, but there are more problems than just an ulnar nerve palsy or cyclist palsy that might present. So we just want to get the conversation out there and get you thinking about some of the things that you might see in clinic. So when it comes to the anatomy, one of the key points to take into account is the fact that we've got a lot of structures passing through really quite a small space in the wrist there. And when we're leaning on those handlebars, there's a lot of pressure on these tissues, and there's not a lot of space for those tissues to absorb that pressure. So when we start layering on top our ligaments, the different deep layers, superficial layers, start bringing into play the nerve fibers trying to fit through that space, you can quickly imagine that any pressure on those structures can end up causing problems. And it is pressure that is generally the contributing factor to any injuries that then develop. So within that anatomy, the common problems that we're going to be seeing in clinic are going to be around the tendons, for example, maybe sort of tenosynovitis of some description, and we'll talk about some of the ones that we commonly or not so commonly see. Or it might be after trauma, so cyclists are forever falling off their bikes and hurting themselves, so it could be tendon damage because of that. Again, with falling off their bikes, then we get wrist fractures. of various types. And again, we're not going to go into a lot of detail for this tonight, but that is something that you may want to brush up on if you want to go over a bit more orthopedic work. And then we've got other lumps and bumps. So those could be ganglia within the wrist, or other changes within the connective tissue. And we're going to talk about Dupatrons as one of these that you might see in clinic. And then there's the ones that everyone thinks about, which is the carpal tunnel, or cyclist palsy, ulnar nerve palsy. So as I mentioned here, the wrist and the hand is one of our key contact points on the bike. In previous webinars, we've talked about the saddle interface, both specifically for male and female cyclists. So if you want to learn more about the saddle, do go back and have a look at some of those webinars. We've talked about the foot and that interface. So the hand is obviously our third one that we'll bring into play. But the type of hand interface with the bike will vary, and the pressures will vary depending on what bike we're talking about, whether it's a road bike, a mountain bike, a time trial or triathlon bike. Tonight, we're just going to focus primarily on the road bike position, but I will touch on a couple of the other hand positions. But something to bear in mind is even on a road bike and drop handlebars like this, we have different contact points. So it's always worth talking to your patient or your client and just exploring how much do they move their hands around on the bike, because that will influence what pressures are going through the hand. So here's a couple of references for you. I talked about before, is that the ulnar nerve and a little bit of the median nerve are the two main studied areas when it comes to hand problems in cyclists. And the ulnar nerve is lying on that transverse carpal ligament. It's right down by the pisiform. So you can imagine that if people are putting a lot of pressure through the heel of the hand, as it were, that this is where the ulnar nerve can then start to get squashed. Or if the wrist is getting flexed or extended rather into an extreme position, that's going to be putting a lot of pressure onto that ulnar nerve. And studies have shown primarily we're seeing pressure on those deeper branches of the ulnar nerve. But it is worth thinking that the symptoms themselves coming through the wrist may have other elements to it. So within physio, we talk about potential double crush syndrome. So it might be that the nerve is being squashed at the wrist, but it could be that there are some other elements, whether it's up at the elbow, up at the shoulder, or even at the neck, which is then contributing to it. So do make sure you explore not just the wrist. Again, just reinforcing that is those sort of deeper layers here. So as I mentioned, we could be looking at higher up here. So other areas for you to think about is, and it's debatable, a thoracic outlet syndrome. Does thoracic outlet syndrome exist? That's not for tonight's talk, but it's worth looking higher up, looking at maybe the medial intermuscular septum, or maybe even going through to the cubital tunnel. But generally, what we're looking at is Guillaume's canal. So what you're going to see in clinic is maybe somebody complaining of pain, particularly over the site of compression. You can do some tests such as Tinel's sign, and that may then come out with some numbness along usually half of that ring finger and that little finger. We can sometimes get a little bit more dorsal involvement. Rarely, but it can happen, is you then end up with motor loss, and particularly within those intrinsic muscles. So those are the things you're going to be looking out for. And as I talked about, there's different hand positions on the bike. And this was a nice study looking at the influence of wearing gloves or not wearing gloves. And again, looking at those different hand positions. And you can see from this pressure mapping that simply wearing gloves does reduce a lot of the pressure going through the heel of the hand there. But even so, even with gloves, you can see those red areas, particularly on the drops, where the rider here is putting a lot of pressure down onto the heel of the hand, and therefore still getting quite high pressures over that ulnar nerve. And there's different types of gloves out there, which again, I'm not going to go into tonight, but it is also worth exploring. Have your patients maybe tried different gloves to reduce those pressures. So again, have a conversation around that. When it comes to the carpal tunnel, generally we'll see this more in our mountain bikers because of the way that the wrist is interacting with the handlebars. And often also the wrist is often more extended as they're leaning on those handlebars there. So we're less likely to see this in our road cyclists, but it does happen, and I have seen it. But again, I think I'd highlight the point that when an athlete comes to you and they're saying they get pins and needles in their hand, is just to make sure you explore that and check that it is either the median nerve or the ulnar nerve, and making sure we're separating those two. So the kind of symptoms we'd be looking for here is that they're complaining of numbness or paresthesia, particularly in the sort of radial 3 digits, often coming on more at night time. So maybe they've done a ride, they've caused some irritation, and they're waking up during the night, and them to wake up and kind of shake their hands to get some relief through there. It often sort of starts off fairly intermittent, but then progresses on to being quite continuous. So maybe it starts off coming on just very late into a ride, but then the more that they do this, the more they cause that irritation, the quicker that can come on during that ride. And if it gets a lot worse, then we start to see some loss of fine motor control, particularly around the thumb, and some weakening of those thenar muscles. But again, the same as what we talked about with the ulnar nerve, is those problems can be seen higher up. So just remind you of the anatomy there. So the median nerve, again, we can start to see maybe some irritation in that, talk about that double crush syndrome, so both at the carpal tunnel itself, but potentially higher up into the forearm or even above the elbow. So again, do explore what's happening in the musculature further up through the forearm or even up into the shoulder or the neck. So don't just focus on the wrist itself. So again, just highlighting some of those potential sites of compression, whether it's up into the axilla or up into the shoulder there. Sometimes we'll see riders who are getting hand problems, and they've been raising the bars, they've been shortening that stem to try and minimize the reach or their perceived pressure on the wrist. But actually all it's doing is forcing those shoulders higher and higher up, causing more tension up in the shoulders, maybe up into the axilla, which is then exacerbating their problems. So one of the things we can sometimes do is take the pressure off those shoulders, take it off the back, and it reduces the pressure on the hands. Dequervin, so moving on to some tendon issues. This is the tenosynovitis of the tendons around the base of the thumb. And I've seen this in triathletes and time trialists where they're working into a very ulnar deviated position, putting a lot of pressure over the base of that thumb. And then they're using the gear shifters if they haven't got electronic shifters particularly. And that's putting a lot of work on that thumb as they're changing up and down. And that's what's then set off dequervins. So if you do see somebody with pain at the base of the thumb, particularly in that time trial position, then that's something to look into. But I've also seen it in people with road bars, with drop handlebars on the hoods. But again, it's where the wrist is then tilted right down. So we'll explore the different hood positions in a minute. And the other thing to be aware of is maybe some of the fractures that can linger on a little bit, such as the scaphoid fracture. So if your patients come to you, they've maybe had a fall recently on their bike, and they're complaining of lingering pain at the base of the thumb, do make sure that you explore the risk of a potential non-healed, non-union scaphoid fracture. And the way you're going to find that is, well, through your clinical examination and your history taking, but certainly through a physical exam of looking at that pressure in the anatomical snuff box. So getting them to pull their thumb up, and you're looking at that little gap in between the tendons at the base of the thumb here. And you can sometimes see a little bit of swelling. There may be tenderness or even up to severe pain in that anatomical snuff box, or pain on compression and axial loading through there. So if any riders are complaining of long-standing grumbling pain at the base of their thumb after a crash or a fall, do make sure you explore that and potentially send off for further imaging there. Other things that I've seen in clinic is Dupatrons. I used to work in a plastics unit, sort of bones and plastics units. Used to see quite a few of these coming through. And this is a fibromatosis affecting a lot of the fascia in the palm, and it results in these thick cords and contractures developing. And I've seen this in cyclists where they're still able to ride. There isn't a lot of maybe contracture pulling on that finger. They can still get a reasonable position, but they've got this big old lump at the base of the palm there, which when they're leaning on that hand can cause a lot of discomfort. So again, it's exploring maybe different padding, different bar positions, ergonomic bars, to try and take some of the pressure away from those lumps and bumps. And again, tonight's not a talk for discussing the management of this, but it's just something for you to be aware of, and how can we adapt and modify those hand positions so that we can keep them riding and keep them on the bike and keep them fit and healthy. And then we can see some of the arthritic changes that happen at the wrist and hand. So this is actually a good friend of mine who has rheumatoid arthritis. Luckily for her, she's based herself out in Spain now, hence the pictures with lovely sunshine that she sent through the other day. And you can see that she has a lot of problems with the base of her thumb now. So she can't actually get her hands round the handlebar, her thumb round the handlebar. So she's adapted her road bike and put straight bars on, flat bars, and put an ergo mountain bike grip on there, which allows her to use the base of the wrist and the hand without having to engage the thumb, and she still then gets some stability through there. So it's thinking maybe a little bit outside the box sometimes. How can we keep these people on the bike, keep her exercising? You know, she's gone through a couple of joint replacements now, so keeping her on the bike is the best way we can keep her exercising, but it's finding a way that she can safely engage with those handlebars and still ride. And you can see in that third picture over that even in that position, she can then still get her fingers onto the brakes and still apply a little bit of force on the brake there. Because, yeah, they're up in the mountains in Spain, so definitely needs the brakes for descending. So what can we do to try and relieve any symptoms in the wrist and the hand? We can think about the type of handlebars that our cyclists are using. The example there from Canyon and many others are going along the same way, a very integrated Cockpit, doesn't actually leave a lot of adjustability to you, versus maybe some of our older style of handlebars where we can obviously rotate and we can move things and change things around, swap components out. But if you have got somebody with more an integrated Cockpit, it is going to make your life a little bit more difficult. But there are still things you can do. If we go back to our old Cockpit styles here, the different handlebars, the bottom picture is showing more of an old school fashionable position where the bars are rotated right down. But what that's going to do is encourage the wrist to go into a lot more ulnar deviation and put a lot more pressure maybe through the thenar eminence or through the base of the ulnar, and maybe even the triangular fibrocartilaginous disc into there. So that can often cause some discomfort, versus rotating the bars up to a more level position can often help the rider engage a more neutral wrist position. So thinking about that wrist angle, that's something I'll definitely look at with the hood position. And this also depends on the reach and the length of the patient's arm or the cyclist's arm, their torso, where the saddle position's coming from. So in our previous webinars, when we talked about saddle positions as our sort of first area to focus on, we would have done that. We've got the saddle into the right position. We've got their hips and their torso into the right position. Now we're thinking about where those handlebars need to be. Often I've seen people who have been trying to change their handlebar position, whether it's shortening the stem, lengthening the stem, raising, lowering, whatever it is. And they've been playing around with this because of neck problems, hand problems, things like this. And it's because they haven't got the seat in the right position. You get that right first, then everything then flows out from there. But do then explore what that wrist angle needs to be. And I often use the analogy that your wrist wants to be in the same position you'd go to shake somebody's hand, that kind of neutral position there, rather than a wrist that's really cocked over to one side. So our colleagues from Bike Fit, they've got quite a lot of good education out there. This is one of their pictures that I've sneakily stolen. And you can see how if the bars are rotated down, it's really bending that wrist into an ulnar deviation, versus if you rotate them up, you can encourage them to get a little bit more relaxation through the elbows and keeping that wrist into a more neutral, relaxed position. So that again helps with things like shock absorbance or the very rough roads. If you've got somebody in a rotated down position, the elbows are going straight, they're going to struggle to absorb some of that road vibration. But what about time trials or triathletes and what kind of positions we get into there? So I talked about some of the cases I've seen of things like de Quervains that have come through and the discomfort that people are getting at the wrists there. So these are two examples of maybe more old school triathlete positions with a very low flat front end. And we're moving away from that into more what we call the kind of praying mantis style, where the hands are coming up. However, even with some of these, we're still seeing people really flexing and ulnar deviating at the wrist, versus if we look over on the right-hand side, being able to keep that wrist into a more neutral position. So I would argue that even if we're trying to get somebody up into this praying mantis style, and particularly for our long course sort of Ironman triathletes, long course triathletes who comfort is a key factor, where they're not maybe cranking on the bars and trying to create tension at the front end, they're wanting to be more relaxed, is you really are looking to try and get that wrist as neutral as possible. So the other handlebar options, I've already briefly touched on. My colleague or my friend even, with rheumatoid arthritis. She's a coaching colleague as well as a friend. And, do you need to actually swap it out? So, on her road bike here, she's put mountain bike handlebars on. Do you need to look at more the kind of touring handlebars and giving people a lot more variations, a lot more options there? Then we can think about adding extra gel padding underneath the bar tape. This is actually one of my bikes. I've retaped it this week just for this demonstration. So we can have tape on the drops, we can have tape on the tops. Because this is an aero bar, I've not put the tape over the tops, but you can see how a little bit of extra gel padding and then taping over the top of that just thickens the bar up there. It takes out some of that vibration and it can support the wrist a little bit more, take out some of the pressure going through the hand. And this is particularly good if you've got people riding on the rough British roads where you're bouncing around all the time, or if somebody's historically got some narrow diameter bars. That's another example where smaller diameter bars are going to end up putting a lot more pressure through the palm. So sometimes double taping can just widen that diameter and again spread that load a little bit more widely over the hand. I've already talked about the use of gloves, but do explore the type of gloves and the type of padding that those gloves have got, whether it's pads specifically over the ulnar or over the pisiform and over the thenar eminence, or is it a pad or glove where actually the pad is more in the middle of the palm in order to get more of an even distribution of that pressure over the whole of the hand. So do explore whether your athletes, whether your patients are using gloves. I would never ride outside without gloves on, but jumping on the turbo and doing long Zwift sessions, I'll often not use gloves and then notice that, my hand's getting a bit sore here. So if you've got people getting really sort of into the online world, e-racing, Zwift, and they're doing big, long turbo sessions, then again, it might be worth exploring, are they actually wearing gloves on the turbo? And is that part of the problem? It's not just the outdoor riding that's contributing to their symptoms. So I talked about the handlebar reach and height, following on once you've sorted out the back end, so dealing with the saddle and the saddle position. So once you've got that right, then you're looking at where those hands need to be. And the number of times I've had people come to me with hand problems, and they've tried adjusting their position, they've gone shorter and shorter, they've come higher and higher, thinking that they're needing to reduce that reach to take the pressure off their hands. And I do the complete opposite, take them further out, get them to relax forward onto their bike. Because often what happens is they end up putting more pressure through their hands, and it's actually pushing them back on the bike there. So getting them to relax out, relax the hand, and often that will reduce a lot of the pressure going through the hands in those different positions. So this is using an adjustable stem. So if you are doing a little bit of bike fitting in your clinic, this is a really useful bit of kit. And there's a few other ones out there. This is the old Salsa one, where you can just swap out their stem, pop this on, and you can try some different lengths of stems and you find out which one's going to be right for them. And then we think about the saddle height and the setback. So again, this all fits into the whole fit of the patient. So if they are coming to you with hand and wrist problems, don't just focus on what's happening at the handlebars and on the hoods. And then some other things you can explore are actually the type of shifters. So again, just sticking purely with our road cyclists, the common ones you're going to deal with are Campag, SRAM, or Shimano. And these different makes of shifters are all slightly different and different sizes as well. So if you've got somebody with really quite small hands, you can sometimes find that the Shimano shifters are actually a little bit too big for them. And you'll often find that Campag hoods, being that little bit smaller, are more comfortable, or SRAM sort of somewhere in the middle there. So I've personally got quite small hands, and I used to have Shimano, and I now just use SRAM on all my bikes, just because the size of those hoods fit the shape and size of my hands a little better. You can also adjust the reach to the brake levers. So there's usually some adjuster screws rather, so you can adjust it so the lever itself is then brought closer in. So if they've got short fingers, and again, I've got fairly short fingers, you can reduce that so they're not having to stretch their fingers. Because sometimes the problem they're getting with the wrist of the hand is they're constantly having to stretch to reach the shifter or stretch to reach the brake lever. So adjusting that in just takes away a lot of that strain and a lot of that reach, and takes away a lot of that discomfort. So do make sure you then explore that one. And that's a good way to make the shifters fit the size of their hands. So just a very brief summary. Our key ones that you're going to see in clinic comes under the name of Handlebar Palsy, cyclist palsy. And this is where somebody comes in and they're complaining of pins and needles, numbness, sometimes even to the extent of motor loss, and coming into the heel of the hand, coming into the little finger, maybe into the ring finger there. So the things to look for is, are they going to too much wrist extension? Are they going to maybe a little bit too much radial deviation, putting the pressure through there? So look at rotating the bars up, rotating the hoods to get that wrist into a neutral position. You may want to raise the bars to take a little bit of that load off it so they're not leaning down onto them too much. But don't forget that sometimes coming up and back too much creates tension. So it might be raising, but it might be raising and even taking out a little bit. Look at the type of bars. Do they need a little bit more shock absorbance with maybe carbon bars, or sticking the gel underneath the bar tape just to take out some of that vibration, some of that pressure through the hand. The other common one you'll see is our carpal tunnel. So again, this is more into the median nerve. So again, it's pins and needles, maybe numbness, and this is again, sometimes a little bit of motor loss. And again, is usually down to too much wrist extension, which is why we'll often see it in our mountain bikers more. So again, we're looking at, can we rotate the bars? Can we rotate the hoods to get that wrist into a more neutral position? Do we need to raise the bars just to take a little bit more load off those hands? And again, it's looking at changing the bar tape or the grips on there in order to reduce the pressure on that. So if you want to have a look at some of our previous webinars, do go onto our website, or we've got other additional reading material you can have a look on there. And if you have any questions, please pop in the chat box. Bianca, is there anything from yourself?
Yeah, definitely. So for those of you watching, I'm not sure exactly where all of you sit in the whole kind of profession, whether some of you are physios, some of you aren't physios, or also what your knowledge is on bikes. But I think some of the things to just really think about are that if someone presents to you and they're just having symptoms on the bike, and they, are present and manifest themselves off the bike, but they self-resolve when the compression is taken away, they're generally individuals that you're probably going to be able to manage by adjusting bicycle ergonomics. But I don't know about you, Tim, but I think nerves can be quite vindictive. We know that once they're aggravated, even if the load on them is not necessarily high, they can then become irritated far more easily. And so if you do get someone that is experiencing symptoms off the bike, then it very well may be that, yes, although you can improve things on the bike and improve and reduce compression, they actually do require a multidisciplinary approach. So carpal tunnel, etc., can be tricky to manage when they have become chronic, because there could be inflammation, which, as Tim has kind of said, there's a lot of anatomy in the hand region, and so nerves and soft tissues, or even the vascular structures, which you haven't really covered, are vulnerable to compression. I think what's really important to think about is that pressure basically equals force divided by area. So if you can affect the force, or if you can affect the area, generally you're going to have a good chance at improving their symptoms, so long as they are directly compression related at the hand. And as a result, some of those things that Tim has spoken about, if we're changing like the group set maybe, and we're going from perhaps an old school Shimano setup or a disc brake Shimano setup to a SRAM setup, you may improve the contact that that individual's hand has with the cockpit, and therefore that is enough to reduce that pressure, or reduce the pressure to a point where it doesn't tip someone over the edge. But it's really important to not just look at the area, because force as well could be, as Tim has said, that's your saddle setback, that's your saddle position. It could also be force externally. So one thing that we probably haven't mentioned, because it's a massive topic, we could go into so much detail, is even tyre width, tyre pressures, suspension. Because I don't know about you, Tim, but I had a steel bike, and it was horrendous on longer rides, and that was literally the only thing that was different, because the shock from the forks just was not the same as having a carbon forged road bike, and I'd obviously been very, very spoiled by that. So
that's the road man here, riding my gravel bike on the roads more than my road bike or my time trial bike, because the roads are that rough. It's just far more comfortable. My time trial bike is lovely on the European smooth tarmac, but it's very tiring on the UK roads. So it's thinking about that kind of road vibration and the implication of even just the frame that the person's riding. Yeah,
definitely. And diameter, diameter of the bars, are they too small or is it too big? You have the opposite problems to me, Tim. I think your hands are a little bit small. Are they smaller than mine?
I got short.
Yeah, I think they are. Yeah. And obviously with the advent of electronic shifting and things like that, it just opens up so much more potential. So I think the real take-home message is, if it's just on the bike, you've got a really, really, really strong chance of alleviating it, because if it's pressure related, then deal with that pressure. But if it's off the bike, it's a team job there.
That's what you've got to bring the full medical team. But the main take-home message, though, is do explore what those hand positions are on the bike. So even if you're not doing bike fitting, if you're a physio that just deals with cyclists, is get them to bring their bike in and have a look at where those hands are engaging with the bike. And you can just use your physio knowledge and understanding of biomechanics to realize that, hold on, they've got their hands in a kind of fashionable, rotating the hands right down and putting a load of force through those hands, and just getting them to rotate the bars to adjust that position. Or again, they bring their bike in and it's a really old, very small diameter handlebar, getting them to double tape it just to widen that diameter. You can use your, dare I say it, your common sense to make some simple changes to the bike setup, and you can have some dramatic influences on their symptoms and their pain and their problems.
Mm-hmm. Yeah, definitely. Absolutely, Tim. If you have any incidents of symptoms that are at the hand, they're only on the bike, you have to consider the bike. You have to look at them on the bike.
And it's a fairly simple fix as well. You know, it's little changes that can make a huge difference to your rider.
Definitely. Definitely.
But if you want to know more, then do just follow us on those usual social media handles there. Do drop us a message if you're treating people in clinic and you need a little bit of advice. Do just drop us a line if there's anything we can do to help. If you get some interesting cases coming through, then again, drop us a line and we can try and help you out as best that we can. Oh, someone just stuck a message up there. Did you say that carbon bars make much of a difference to shock absorption compared to alloy, as opposed to the whole frame or the forks? That's an interesting one, actually, because there was a study looking at the Pro Peloton was it a year or two back? Well, it can't have been this year. There wasn't much going on with Pro Peloton this year. That actually there was a hell of a lot of bars which were alloys. They weren't carbon. But one of the kind of fears with carbon bars is obviously you fall off and you crack them, and that's your bars knackered. But generally what we do see is carbon bars will just absorb a lot of that shock a little better than alloys. And I don't know if you've seen, but Canyon had that funky new handlebar set up for their gravel bike, where they were thinking about how do we try and change that load so that a lot of the time when you're just riding here, is actually you've got a bit more of a suspension on the top. So they had almost like a double handlebar in order to take out some of that pressure. And that has had some really good reviews. So yeah, it is just having that little bit more flex, a little bit more bend into there from the carbon bars does make a difference, particularly if you're on rough roads. Yeah.
But I think it's an expensive decision to make. So it's worth getting the other things right first before you explore that route, I would say.
Yeah, but I think if you're riding, if you've got carbon forks, maybe carbon forks on an alloy frame, but you've got alloy bars, then, if you've got the position right, but you're still finding that bright vibration, the road rumble is an issue, then yeah, the next upgrade I would say would be carbon bars from there. You don't have to go crazy money on the carbon bars, although you can. But yeah, it is going to be the more expensive option beyond maybe even just getting a bike fit to begin with.
And watch the integrated carbon bars.
Yeah.
Because you'll negate the point of buying them in the first place.
Yeah. Does that answer your question, Gillian? There's a little bit of a delay on the line, so we'll give another sort of minute or so if anybody has any other questions you wanted to ask.
Tim, have you used butterfly bars before, or have you seen many people use butterfly bars before?
Yes, in the sort of maybe some longer distance Audax riders, tried with that friend of mine with the rheumatoid arthritis, actually tried them to begin with, but what we found is even trying to get the thumb round the bars in those different positions it was still a no-go, hence why shifting to the more sort of mountain bike ergon bars there. So yeah, but it is worth exploring some outside the box type handlebars in order to keep your riders on the bike if they have got more long-term wrist problems or hand problems.
Yeah, or tri bars on your road bars too.
Yeah. So yeah, like I say, if you have any further questions or if you want to ask anything, do get in touch with us. We do just want to get the conversation out there. So drop us a line on any of those social media handles, and one of us will get back to you. Bianca's usually far more swift off the mark when it comes to the replying on social media, but I am on there as well. I do it as well. Okay, thanks very much for joining us. Bianca, do you want to just plug the next one with Bill?
Oh yeah, that's a really good shout, actually. So for those of you that are watching right now, we've got a really, really, really fabulous pelvic health physio joining us at the end of the month. So if you're someone who sees cyclists and perhaps wants to know a little bit more about some of the diagnoses that you might have, or also about how you facilitate them returning back to the bike, then it'd be a really good one to watch, because Bill basically is a pelvic health physio. with experience in men's and women's pelvic health. So yeah, perfect man for the job, really. And also keep your eyes peeled for Feb, because hopefully we've got a really awesome individual joining us.
Yeah, she's confirmed. So Emma Pooley, who I coach now, she's going to join us for a talk, and we'll discuss some different topics regarding maybe sort of female cyclists, and maybe small female cyclists, because she is a small female cyclist.
Tiny.
And there's not many of those. So yeah, so look out for that. Follow us on the usual social media channels there, just to get the heads up for the exact date for that one. Haven't actually confirmed the date with Emma yet, but she is up for it. So yeah. Okay. Right. Thanks very much. Bye.